What's up, y'all? It's Celeste, and today is Monday, so it's post-op day 6. And in just a little bit, I'm going to Dr. Garramone's office, and I'm going to have my reveal. And I'm really excited, first of all, to see my chest for the first time, but then also because I'm really looking forward to getting this bandage off and these drains out because they're really irritating. So, see you in just a little bit.
Hey, how you doing? Pretty good? All right, that whole plate of stuff was almost gone. Thank you again for that. I came in today and there's like, I think, 1 or 2 left. All right, it looks good. Not much has come out.
Yeah, it's not a lot.
Yeah,
I'm
that's
going to hand that to you. You
Okay.
can put that in the scrapbook.
Oh, okay.
So we're going to get you unwrapped here. Has your pain control been okay?
Yeah, they're pretty
Doing
good.
pretty good? Okay, good.
It's all right if I do
Oh, yeah.
this.
7,000 other people have already done it.
Yeah,
so I'm sure
we-
I couldn't say no.
We've seen a few of them.
That's funny. It's like thousands and thousands of people coming here to videotape it. It's crazy.
Yeah.
Yeah, that's my phone.
That's not me, is it?
No, it's
Okay.
I can see my fingers. And then you scoot forward with your feet on the ground and just put your elbows up on the sides. Just like that. There we go. And you do this. Got it? Hold on up. Get the baby powder flying in there. Okay, so we're going to leave this off for a few hours. I want you to put it back on later today. It does not need to be tight, just a little bit snug.
Okay.
You need to wear it every day for the next 2 weeks, taking it off when you shower. And you need to wash it too. So when you wash it, you're going to unravel it, you're going to put it inside of a pillowcase, and you'll wash and dry it in the pillowcase so it doesn't get damaged. It'll feel a lot better in a second here once this gets loose right there. The patient's like, oh, the
Yeah.
You've been waiting for this moment.
There you go. Now you can take a breath. Huh? I'm going to put this over here, okay?
Okay.
Just put it inside that plastic bag before you leave the room.
Okay.
Now I'm going to sort of loosen all this stuff. So let's take this along. There you go. Try to be gentle. That looks awesome. You want to stand and take a look? Now we've got the typical ripples, wrinkles, and puffiness. Don't worry about all that stuff. That's going to go away over the next several weeks, okay?
Okay.
It'll all be nice and smooth and flat and contoured. The stereo strips, you're going to leave these on for 1 more week. They don't fall off by next week, and you can peel them off, and you're okay to use scar guard on the incisions. The nipples down, the lower outer border, the pectoral muscle, you've got good pec development already, which is really good. Wasn't noticeable before, now you can actually see you have it. On the side, nice and flat, no puckering, it looks really good.
Yeah. Great, and this looks a lot better too now that this.
Yeah, it's smoothed out, because I went up, like I told you, I dissect up over here, even on both sides. And you'll feel a little more tenderness in here, but eventually once the pain starts, coming back, because it will come back, and then this will all start to smooth out.
Okay.
It looks great.
Yeah, it looks great. Thank
All
you.
right, let's get your drains out, okay? Okay, so have a seat right there. I'll hold on to the drains, just scoot back all the way. And hold that for me. And I'll raise you up and lay down flat.
When you said the pain will come back, what did you mean by
Usually
it?
people are a little numb initially.
Okay.
And then once that numbness starts to wear off a little bit, when the swelling goes down, then you start to feel the discomfort of having surgery.
Okay.
Believe it or not, it's kind of strange. It's almost like a secondary thing.
Okay.
But then again, even saying that, usually most pain goes and dissipates. But you'll get a little bit, you'll say, oh, that hurts a little bit where I had this done. And then it'll fade and go away.
How long does that usually take?
It honestly, most patients are pretty comfortable. Like, if you feel okay right now, you're probably going to be fine. Like, the worst pain you had is already, subsided. You right now enough for me too. But if you feel discomfort in that spot, you'll notice it because that's where we did that extra little area of work there to help flatten that out. I'm just cutting the suture that's holding the drain in place.
I'm sorry.
No, you're fine. Don't worry about me.
Okay. Well, we have to have you be able to work.
Turn your head that way. So you're going to take a deep breath in, and you're going to blow out. We'll take out the drain. Deep breath, blow out, and that's it. Drains out already.
Wow, I hardly felt it at all.
Take this one out too. Hopefully you don't fill this one either. So let's do it. Deep breath, blow out, and that's it. Drain's gone. You okay?
Yeah.
Little clock wants to follow that. Now there's a tiny hole right at the end of the incision. You need to cover that with a bandage and some antibiotic ointment once a day. It takes about a week to close up, and maybe leak a little bit of fluid. There you go.
But wash it normally? Wash it in the shower or no?
Oh yeah. No, I'll go over that with you in a second. But yeah,
Okay.
you can wash over it. You take the bandages off the wash, obviously. Nothing's going to go back in unless you're submerging in a tub, which you're not going to do for a while. Okay.
Is what you're doing there, is that the kind of bandage I should use?
You can use regular Band-Aid with some antibiotic ointment. Yeah.
Okay.
Now the nipples always look a little gross initially. The outer layer of skin is going to peel away over the next week. Just relax right back. Just you're in the spa. Just relax. Think about it. Laying on the beach somewhere. The new skin cells will grow back on top of this over the next couple of weeks. And then the nipple projection actually typically returns after several weeks. I'll show it to you in a second here. Now, if you take a look down, you can see here's the areola. Nipples in the center, it's a little flat, eventually it projects out. These little brown sutures will fall on their own. Any bleeding from the edges typically stops after about a hair or so.
Okay.
Yeah, I'm not going back on that side, so if you want to stand over there, you're welcome to.
Okay, thanks.
And that looks good too. You got 2 nipples. So you can start showering tomorrow. Let the water hit your back and run over your chest. Do not face the shower because you can damage your nipples. When you get out of the shower, you're going to pat yourself dry with a clean towel, and then you'll do the dressings, okay? And I'm going to give you 2 sheets of yellow gauze called Zeroform. They're in the foil packets back there in the plastic bag. I'm also going to give you these scissors and forceps. These are brand new. You can use these to cut the dressing, so I'll put them back in the little kit they came in.
Okay.
You can put this in the plastic bag over here. You're going to do these dressings once a day for 3 weeks. So what you're going to do is cut 2 squares of yellow gauze, put 1 right on top of each nipple, then get yourself some antibiotic ointment like Paxotracin or Neosporin. Take a dab of that stuff and put it right on top, and then you spread on top.
Okay.
Very simple. Now, I'm going to cover this with gauze, but I recommend you buy those large square Band-Aids. Just peel them open, put them on top, save you a lot of time.
Okay.
So the next 2 weeks, you really do need to take it easy. No strenuous activities, no heavy lifting. Keep your arms down by your side as much as you can. After 2 weeks, you can start to use your arms a little bit more. Just no heavy lifting or exercise for at least 6 weeks.
Okay.
If you run into any issues, you know where to find me. You can call me. You don't live that far away. You can always come back down if there's ever an issue with anything.
Okay.
But call me, okay, if there's an issue with anything at all.
Okay.
Any questions?
As far as the shower, I know that I can't have the water go directly on here, but what if to like, wash my hair, I'm like facing the shower but like leaning forward? Is that okay?
Yeah, just be careful.
Splashes a little bit. Or?
Yeah, just try to do it from behind or wash it from
I
behind,
just
not,
didn't know
not
if I
facing.
could reach.
Yeah, you
Like
can
I
do
was
that.
thinking
Activities,
maybe
the other like that is okay. Okay. I don't want, some people's showers are really strong, and those jets will blast right to the nipple, and if it even catches like a little gap, it'll like go underneath it and kind of rip it up, and you don't want that to happen.
Okay.
That'd be awful. I mean,
Yeah.
it'd be the worst thing to happen.
Hey, so it's now Tuesday and we are at a hotel. We stopped off part of the way home yesterday after leaving Dr. Garramone's office. And so in just a few hours I will be home, and so I'm really excited about that. But I just wanted to give a little final, wrap up or whatever of my reveal day because I didn't get a chance to do that last night. So first of all, on our way to the appointment, we stopped at Panera to get lunch, and it was like the worst Panera I've ever been to. I never actually got my lunch there because they just took so long. But I went to the bathroom there, and I was going into the bathroom, and a guy came out of the men's bathroom. I was going to the women's bathroom, and a guy came out of the men's bathroom and like glanced up at me and was like, "That's the women's." And I just kind of like, I don't know, I guess I sort of like nodded or something and just like went in anyway. But it was really weird because like that's never happened to me before, and I've heard that story so many times of other people telling that that's happened to them. And this was the first time that it's actually happened to me, and it was really weird because like I look exactly the same as I always have, other than the fact that I have a flat chest, and I didn't think that that would necessarily happen because I don't know, like I don't think I necessarily look all that much more masculine. But anyway, I thought it was really funny that that happened like before I even got the whole bandage off and everything. But yeah, so that was interesting that that happened like on my way to my reveal appointment. But and also I'm sorry about the angle of this. It's kind of hard to hold my arm all the way up, so I'm kind of like resting my, can you see that? I'm like resting my elbow against my other arm. Also, I wanted to mention a couple of things from the last couple of days since my last post-op update, because I didn't get to talk about those. After my last one, where I talked about how tight the bandage was and how irritating it was, like shortly after that it got really bad, and it was very tight and very uncomfortable, and I actually was kind of worried that evening. This was on Saturday, so that was day 4. That was day 4 post-op. Yeah, day 4. And I was actually kind of worried because it felt so tight and so constricting on my ribs, and like I was worried because I've heard stuff about people binding too long and like hurting their ribs and stuff, and like that's what it felt like. It felt like my ribs were being crushed. It was not a good experience. But it wasn't even necessarily that it hurt that bad. It wasn't like that it wasn't about my discomfort, like it wasn't like I couldn't take the pain. It was that I was worried because I just didn't know if something was wrong or if it was supposed to feel like that. But I decided it was probably fine. So it obviously was, but it was very uncomfortable. So just keep that in mind if you go through this, that at some point your bandage might feel very, very tight, and it might feel like something's wrong, but it probably isn't. But obviously, if you really think something's wrong, you should call your doctor. But I wasn't really prepared for that, so just keep that in mind. Also, because of that, because I hadn't slept very well the 2 nights before that, I did start taking the Percocet again just at night, just one time when I was going to bed, and so that has helped me sleep a little bit better, but I'm still just taking Tylenol during the day, so I'm trying to avoid taking the Percocet more than I need to, but I did decide to go back to taking it at night just to allow me to sleep better, because being in that position is more uncomfortable. So last night was my first night sleeping with just the ACE bandage and not like all the padding and underneath and the drains and everything like that. And it was my first time also sleeping in a bed, but I was able to get fairly comfortable. Yeah, it wasn't too bad. I did wake up a few times, but I mean, it was a hotel, so that's not that unusual anyway, but it wasn't the most comfortable, but it was doable, and I was able to get up and out of bed by myself and everything, so that was good. Oh yeah, and I also had kind of a reaction to the medical tape. It was really itchy and really irritating to my skin. It kind of broke out around that area. So I'm going to show you that now. So just be warned, I'm about to show you irritated, red, kind of scabby looking skin. But I just wanted to show you what that looks like, just so you can be prepared that that could possibly happen to you. But if you don't have really sensitive skin like I do, then you'll probably be fine. My skin's just really touchy. I got to take a shower for the first time today, so that was awesome. It was still kind of hard to get everywhere and because I can't use as much force with my hands as I normally could. It was a little bit harder to feel like I was getting as clean and everything and as dry afterward, but it was fine. It just took a little bit more adjusting than usual. And so I'm sure that once I get home, there's going to be a lot of that. There's going to be a lot of getting used to new routines and stuff. Hopefully not for too long, because hopefully I'll be healing up in a few weeks and we'll be able to do stuff more normally. But for a little while it's going to be probably frustrating. So I'm looking forward to getting home. I'm a little bit nervous about that part, but it's going to be fine. So that's pretty much it. I just wanted to mention those things before I forgot them, and obviously I'll be making more videos once I get home, but wanted to make sure I talked about all my reveal stuff and my final post-op week stuff in this video. So as always, you can ask questions in the comments below or message me or whatever. And if you like this video, give it a thumbs up and subscribe to see more of my future content. Thanks so much for watching, and I'll see you guys next time.